You know, we always hope as you watch us on 3+U that you're feeling great, your day is going well. But if you are watching this morning and maybe you or someone you know and love is experiencing some back pain, some neck pain, you're going to be in luck because Dr. Michael Hermann is here with us this morning. He is with the Center for Sports Medicine and he is a non-operative spine specialist. So nice to see you.
Thanks for having me.
So I think that first of all, a lot of us when we think about back pain, I anyway, first think about quite literally the back. But there is a difference in back pain and spine pain, right?
Yeah, I mean, you know, I think of low back commonly too, but you can have back pain anywhere from your neck all the way down to, you know, close to where your belt line is.
So when you came in this morning, I said, all right, are we going to talk about something new and exciting that you're doing in the practice? And you said, well, we could, but you kind of want to focus on the old standard that people don't always think of, and that's epidurals.
Yeah, a lot of people don't know what an epidural is. You know, they think any shot's an epidural. But, you know, epidurals can be used for a variety of things. Sometimes we use it for diagnostic reasons, and sometimes we use it, you know, hopefully in thinking that it could be a therapy for somebody in the long term.
So an epidural is intended by its very nature to kind of numb the pain? Is that the idea behind it?
I'll tell you what I usually tell patients. You know, epidurals are really simple. I always say I wish they were complicated, but they're really not. You know, we just clean off your back or wherever we're doing it, numb up the skin, put in a small needle, inject the medicine, and that's really it. We do it under x-ray, so we want to be sure we're delivering the medicine in the right place. That's one way it's different than a labor epidural, you know, where they're doing it by feel. You don't want to do an x-ray with a, you know, with a baby right there.
Right.
But yeah, it does numb the pain, but, you know, they're still figuring out how epidurals work, and they work through a variety of ways.
So I'm trying to think as we talk to some conversations I've had with friends over the years, and it seems like I've known a few people who've gone in and it was going to be, quote, we're going to try an epidural because it doesn't always work, but even that would be telling to you.
Yeah, exactly. You know, I tell folks we hope for a therapeutic benefit, meaning that it lasts long term, but we also want a diagnostic benefit where even if you get amazing relief and it lasts a day, that helps us know where your problem's coming from. And if it doesn't last long, then we move to something else.
They're intended to last in an ideal scenario, what, like a month to 3 months kind of thing?
Oh yeah, we hope at least 3 months. You know, and I mean, I have some folks, I see them once a year, they get an epidural and they're good to go. You know, we just never know.
So you do have this full comprehensive team at Center for Sports Medicine. So I think you were joking with me saying that you call it the spine ecosystem.
Yes, yeah, we call it the ecosystem because we all have different roles and we collaborate quite a bit. And so, for instance, like you were saying, if it doesn't last long, you know, we're kind of thinking like, what do you do? And so what we like to do is, you know, if it doesn't last, you know, we think of what's the next step. You know, I always say I like to have a plan B, and sometimes that means surgery. But we usually start with conservative things like physical therapy. They're part of that ecosystem too.
So I want to talk about the conservative approach because on the one hand, you think, oh good, I'm glad I don't have somebody who's rushing me into surgery. On the other hand, you hurt. And so to hear someone say, let's take a conservative approach can be frightening sometimes because you want to quit hurting. So is that part of the conversation you have with your patients to kind of see where they are comfort-wise?
Yeah, I mean, for me, you know, I'm definitely like, I do non-operative management, but I always like, my personality is much more like, let's fix this. And so I think the idea is like conservative means slow improvement, but not necessarily, you know. An epidural is a conservative approach, and if we can get you out of pain quickly, and you're really hurting, you know, we try to do that.
We are entering into this most active season of the year, I would say. I mean, everybody wants to be outdoors, doing something fun. Even just basic yard work can get you like that. So are there some things to be mindful of? Is posture important in trying to ward off problems with your spine?
Yeah, and I think sometimes, you know, some problems are related to injuries, you know, potentially due to bad posture, and sometimes it's just, you know, part of getting older or how people age.
Is arthritis benefited by epidurals?
Actually, that's a totally different procedure, but that's a really great question. We have a procedure specifically for arthritis because typically surgeons don't like to go in and operate on arthritis in the back. It's kind of unique compared to other parts of the body.
So you have something that's non-operative that can help alleviate that pain?
Sure, yeah. It's been around for about 50 years. It's called a radiofrequency ablation.
So is it kind of, you know, it's the practice of medicine. We talk about the practice of medicine. So if you saw 10 or 15 patients in the course of a day, all with the same complaint, you would have to find a different fix for each of them potentially, right? Because their bodies might respond differently.
Yeah, it's like a new chapter each time you see someone. So you kind of have to tailor it and customize it to them.
But don't give up. If you are dealing with this chronic pain, don't think that you're stuck with it.
Yeah, that's what I tell folks. I usually say, you know, this doesn't have to be forever.
Okay, well, here is where you will find him. You know, I'm sure that Center for Sports Medicine has offices all over the area, but if you go to sportmed.com, you can learn more about Dr. Hermann. Call them. He is at different locations around the area to serve you in a convenient way. 624-2696.